Welcome to Medical Spa Insider. I'm Kathy Christensen, President and CSO of AM Spa, and I'm happy to welcome you to this very special podcast featuring 4 leaders in the medical spa industry who are also featured speakers at the upcoming Medical Spa Show 2025. This week, we are so pleased to chat with Medical Spa Show speakers Sara Cole, AGACNP-BC, CANS, Siren Medical Spa, Chakika Williams, DNP-L, MBA, HCM, FNP-BC, PMHNP-BC, FPA, SkyRose Rejuvenation Clinic and Spa, Dr. Alexander Rivkin, Westside Aesthetics, Alyssa Rapp, Empower Aesthetics, Georgia Cirese, RN, CANS, CLT, Georgia's Aesthetic Bar, and Jenna Hilton, PAC, Vibrant Skin Bar. Before we kick things off, we would love to give you the chance to see these faculty members, as well as all of our other speakers and exhibitors while enjoying the parties, networking, and fun in Vegas at MSS. As a Medical Spa Insider podcast listener, we're offering you 10% off registration. Just use the code Medical Spa Insider MSS25, all caps, Medical Spa Insider MSS25, all caps, as a promo code when you register at www.medicalspashow.com.
Promo code expires on April 10, 2025 at 11:59 p.m. Pacific Standard Time. Promo code only applies to the primary registrant. Promo code cannot be applied towards additional attendee registration and cannot be combined with any additional offers. Discount only applicable to new MSS 25 registrants.
And now, without further ado, please welcome Sara Cole.
Hey guys, it's Sara Cole here, nurse practitioner and owner of Siren Medical Spa. I am so excited to be speaking at AM Spa's Medical Spa Show in Las Vegas, April 11th through the 13th at the Wynn Resort and Casino. Guys, I can't wait to meet all of you. So I've been practicing medical aesthetics for about 7 years now, and while there have been a tremendous amount of triumphs and things that I have really had the pleasure of celebrating, I would say this past year, what I celebrated the absolute most and was most proud of was the opening of my own medical spa, Siren Medical Spa, nestled beautifully on Rowan Boulevard at Rowan University in South Jersey. And I am just so proud of what we have accomplished in such a short period of time. We celebrate our birthday on January 15th, and we are just a small practice. We have 3 nurse practitioners that we've grown to, and we have 2 incredible estheticians, and I'm just so proud of what we've already accomplished, and I'm excited to see what 2025 brings for us. Another really exciting accomplishment that I would like to share with all of you is my organization called Injectors Gone Wild. Injectors Gone Wild is a group of women and men, providers who honestly value community over competition and really want to help each other grow. We're a group of providers now by the hundreds in South Jersey, Delaware, New York, and Pennsylvania area that get together and network and really come up with incredible educational opportunities. We just celebrated our InjectorCon 2.0 gala at the Camden Aquarium in New Jersey. We had about 134 attendees, and it was absolutely incredible and a lot of fun. Yikes, what is my biggest business failure thus far? As a new business owner, I have been completely humbled by how much work goes on behind the scenes. And a lot of the time, I feel like I'm just hanging on by a thread. I'm a mother of 2 young children, a wife, trying to do it all, and now I'm a business owner. And I have never valued all of you business owners out there more than I do right now. Now, what I can say is while this year really, was a great start to my business, and we've had a tremendous amount of patients come to the practice, and we've really had a lot of positivity. One of the things that stood out to me that unfortunately was a failure on my part was our first relatively negative review. We've been really lucky where we've had about 70 organic 5-star positive reviews, just really ranting and raving about how much they love their experience at Siren Medical Spa. And recently, there was a negative review about how the patient essentially did not feel heard. Now, I was upset. I couldn't think about anything else. I didn't cry, but I couldn't eat, sleep, focus on anything else. So what this lesson taught me after I reached out to the patient, after I really kind of figured out what the true issue was, is I needed to take a step back, self-reflect, and realize there are days when I'm busy and I need to make sure that the patient truly hears and understands what the game plan is. This patient felt rushed. She didn't understand what I was trying to tell her. And because I was limited with time, the patient left and felt unheard. Now, I will never allow for this to happen again. I am actually grateful that this experience took place and it has changed my practice. And I'm going to make sure that I allow additional time at the end of each consultation where the patient repeats back to me what we spoke about, so that if there's any clarification that needs to happen, it's going to happen at that exact moment. Random fun fact, my medical spa actually has crystals in the flooring. So when they poured the concrete after they did the plumbing, I came in with just a boatload of crystals for positive energy and just sprinkled them all over the place. They poured the concrete and I just kind of manifested positive energy, positive vibes, and everything about Siren, I wanted to just be extremely positive. I even had a patient of mine, and she still comes in every once in a while to do this for me, but she goes around to each procedure room and she just cleanses it, sages it, speaks, positive thoughts into the space. And I have truly felt a huge difference. There was one instance where a couple months ago where glass just started breaking in front of me, like a candle broke and a vial of something broke in front of me, and we had 2 patients come in and they just had terrible energy and they were really upset about certain things that didn't make sense. And I called her right up. I said, listen, you need to come right back here and you need to fix this. So she came in, she cleansed the whole space, and it was like a weight was completely lifted. So I really recommend every once in a while to kind of assess the energy that's in your space, the energy that you are bringing to your space, and make sure that it's something enlightening, very powerful, and just positive. So I invite you all to join me for my talk on April 12th at the Medical Spa Show from 10:10 a.m. until 10:35 a.m. I'm going to be talking about the psychology behind your best consultation at the Strategic Leadership and Effective Management Practices track. Now, my talk is really doing a deep dive into why are we asking the questions we're asking? Why are we doing the things that we're doing? What are the red flags we're looking for and why? It's really the psychology piece behind our consultation. I had an absolute blast looking up all of this information and doing a deep dive into the literature. It's something you definitely don't want to miss. I'm also speaking on Sunday, April 13th at 9 a.m. to 10:30 a.m. in the Bridging the Divide Conversations on Controversial Issues track on the panel. When it's right to say no to a patient, when is it right to say no to self-injecting and injecting outside of your comfort zone. So that's going to be another really fun and important topic and track to be a part of. On that same day at 11:15.
Hello everyone, I am Dr. Chakika Williams, doctor prepared, board certified family and psych mental health nurse practitioner. I am the proud owner and founder of SkyRose Rejuvenation Clinic and Spa, and I am so excited to be a speaker at the MSPA's Medical Spa Show. I've been in the medical aesthetics industry for about 6 years, and during that time, I've had the honor of building a business that not only serves my clients, but also uplifts my community. One of my proudest accomplishments is establishing SkyRose Rejuvenation Clinic and Spa. It's a space that blends cutting-edge medical aesthetics with a warm, inclusive environment. SkyRose has been recognized as Southland's best in the region medical spa for 3 consecutive years, a testament to the dedication, expertise, and care that we provide to every client who walks through our doors. Beyond the awards, what truly fills me with pride is the positive impact we've made in helping people feel more confident in their skin and more empowered in their lives. Another highlight of my career has been founding the Medical Aesthetics Academy. This is a platform designed to train and mentor diverse providers who are passionate about entering and excelling in the aesthetic industry. As a woman of color, I witnessed firsthand some of the barriers that exist, and I wanted to create a pathway that not only helps to overcome them, but also get them through it. The Academy, I've had the privilege of mentoring an incredible group of providers who are now creating their own successful practices and fostering inclusivity in their communities. Watching their confidence grow and seeing the ripple effect of their impact has been one of the most rewarding aspects of my journey. It reminds me why I started this work in the first place, to show others that no matter where you come from or what you look like, there is a place for everyone at the table. My biggest business failure or clinical failure was underestimating the importance of building robust systems and processes early in my journey. Like many other entrepreneurs, I was so focused on growing the business and delivering exceptional client care that I overlooked the foundational infrastructure that I needed to support the growth that I was looking for. As a result, I faced unnecessary stress, inefficiencies, and roadblocks that slowed down my ability to scale effectively. There were times when I felt overwhelmed, juggling everything on my own and trying to keep up with the demands of a growing business without the right systems in place. This experience taught me a valuable lesson about the critical role that operational excellence plays in the long-term success of a business. I realized that having clear and well-defined processes not only helped things run more smoothly, but it also created a better experience for clients and a more manageable workload for the team. It also taught me the importance of delegation, trusting capable individuals to take ownership of key tasks and recognizing that I didn't have to do this by myself. Letting go and building a strong team transformed my business tremendously. And it allowed me to focus on being the visionary leader that they needed from me. And this is something that we all need to do. So today I prioritize building and refining my systems, investing in the right tools, and empowering my team to take initiative. These changes have not only improved the day-to-day operations of my business, but also given me the peace of mind and freedom to focus on growth, innovation, and serving my clients at the highest level. While that failure was challenging, it ultimately became a turning point that shaped my success and taught me how to build a business with intention and resilience. I invite you to join me at the Medical Spa Show 2025. My session is on Saturday, April 12th from 10:35 to 11 a.m. in the Inclusive Beauty, Embracing Diversity and Equity in Medical Spas track. The title of my talk is Diversity in Aesthetics. All faces are not created equal. In this session, I will dive into the nuisance of providing aesthetic services to diverse populations, focusing on the importance of understanding the cultural beauty standards, as well as variations in skin physiology and facial anatomy across different ethnicities. I'll cover practical tips on how to assess and treat clients of all backgrounds with safety and precision, including product selection and techniques that enhance their natural beauty. But this session goes beyond clinical skills, y'all. We'll also explore how to build a truly inclusive practice, one that resonates with clients from all walks of life. I'll share insights on creating marketing and branding strategies that reflect diversity, fostering an environment where everyone feels welcome and valued. That is always going to be that key. Attendees will leave with actionable strategies to better serve their clients, grow their businesses, and stand out in an increasingly diverse market. More importantly, they'll understand why inclusivity is not just for businesses. It's essential for transforming lives and building trust within your community. This conversation is critical because our industry has a responsibility to represent and celebrate all faces, all tones, and all stories. By embracing diversity, we're not only advancing our practices, but also reshaping the landscape of medical aesthetics for the better. I look forward to sharing this vision with you, and I hope to see you there. April 12th, 10:35 at the Wynn Resort and Casino, y'all. Talk soon.
Hi, I'm Alexander Rivkin of Rivkin Aesthetics, and I'm very excited to be a speaker at the AMSPA Medical Spa show. So I've been in the medical aesthetic industry for 20 years, and the clinical success I'm most proud of is popularizing non-surgical rhinoplasty. In 2004, as aesthetic filler injection was just coming into widespread use, I recognized the potential of these fillers to correct some patients' nasal aesthetic concerns, saving these patients trauma, the risk, and the expense of a really relatively complex surgical procedure. I've been thrilled to see non-surgical rhinoplasty take off and become adopted by so many people all over the world, so many great injectors, and I spent a lot of time and energy modifying the technique, trying to make it as absolutely as safe as I can. Non-surgical rhinoplasty and non-surgical facial sculpting in general has really become the primary focus of my practice over the last 20 years. It's been really gratifying to see how much happiness this procedure has brought to my patients, as well as to the patients of all the non-surgical rhinoplasty injectors all over the world. So that's been really great. I think that my biggest business failure has been to run my practice like a doctor and not like a businessman for a long time. And so for many years, I was running a practice, or I had someone, office manager, who was running the practice, and neither one of us really has had training or really had the skills to run a sophisticated business. And that's what we all have, is fairly sophisticated businesses. And not until I hired someone with actual business training did I really see the difference that that a trained person can have on a business like this. The ability to negotiate contracts, the ability to structure pay, the ability to really keep track of the most important variables in the profit and in the survival of this business. I invite you to check out my session at the Medical Spa Show 2025. My class is taking place on Friday, April 11th from 3:50 to 4:15 p.m. in the Clinical Innovation Track 1, Bridging Theory and Practice. And the title of my talk is Non-Surgical Rhinoplasty, the Good, the Bad, and the Ugly. So during this session, I'm going to cover my thought process when I perform non-surgical rhinoplasty. So all the things I think about. So what's good patient selection? Who is the patient that you really want to perform the procedure on? What kinds of issues will this procedure optimally fix versus the kinds of patients that really rather refer over to surgical rhinoplasty. What fillers are good for the procedure, what fillers are not so great. What's the equipment that you need? Do you inject out of the syringe that it comes with, or do you backload into a BD syringe? So, how do you use that, those tools? How do you do if you're going to backload, how do you backload in a way that's as sterile as possible? How do you perform in terms of technique each of the kinds of maneuvers that I would want to perform as part of this procedure for the particular cases? How to prevent complications, how to recognize complications, how to correct complications, and what do you want to have on hand in order to be as well prepared as possible to manage complications should they happen. All right. So it should be a really exciting session, and I'm psyched for it, and I hope you'll be there. I think you'll learn a lot. Thanks.
Hi, everyone. My name is Alyssa Rapp. I'm the CEO of Empower Aesthetics. I've been in the medical aesthetics industry, I guess, for about 3 years. I started as a board member of Empower Aesthetics, a platform started by Shore Capital Partners about 3 years ago. But I stepped in from the board as the CEO exactly 1 year ago. And it's been an awesome experience and a wonderful opportunity to work with our seller partners, the 4 or 5 I've brought on, and the few we know will be coming to join us soon. I've just loved every minute and learning from them how much they know about medical aesthetics. They teach our team about medical aesthetics, and most importantly, the clinical excellence and clinical care they deliver to our network of patients. I'd say my biggest business failures over the last 20 years have been when I didn't listen to my intuition, whether that was hiring someone or going into a partnership, whatever the case may be, I would say not listening to my intuition has probably been when I've made the biggest mistakes. And I guess appropriately, the title of my talk will be Leadership and Life Hacks, Insights from a Mom, Wife, Entrepreneur, and Executive, the same title of that book over there. And really what I look forward to covering is strategic leadership and effective management practices across the board, and those that we've already seen and I've already seen work particularly effectively in the medical aesthetics space. So that session will be at the Med Spa Show 2025. It's Friday, April 13th from 1 to 1:30 p.m. and would be really delighted to see you there. And we also know that there'll be lots of wonderful people speaking. I look forward to hearing all of the speakers candidly, but would really appreciate seeing you on April 13th from 1 to 1:30 p.m. Thanks so much and see you soon.
Hi, my name's Georgia Cirese, and I am the founder, co-owner, clinical director, nurse injector, and educator here at Georgia's Aesthetic Bar in Kansas City, Missouri. I have over 25 years of experience in the aesthetic medical profession. I spent 5 years with a prominent plastic surgeon here in Kansas City. We opened up one of the very first med spas in Kansas City in 1999, before anybody even knew what a med spa was. And then I spent 15 years in cosmetic dermatology, opening up several cosmetic clinics for a very large dermatology practice. And in 2019, one of the things I'm the most proud of is my daughter urged me to open up our own med spa. So she's been really my driving force, my co-founder. She does a great job with marketing, and she's the business behind this business. So I'm very proud of that fact that I get to work with her every day, and she's a young leader in this beautiful aesthetic medicine field. We opened in 2019. A brief little story is that we opened up in October, and then in March we had to shut down for COVID. And I'm forever grateful to AmSpa, because being a part of this organization for many years and being a member, I was watching every day all the online, the live webinars. I mean, we learned so much during that pandemic, and AmSpa gave us so many tools to help us to survive and thrive. And so for that, I'm forever grateful. This year, I will be speaking on the Strategic Leadership and Effective Management Practice track. And I chose this track because I really want to talk about selling, right? Selling is one of the hardest things we have to do as a medical professional, but we don't want to sell. We want to educate our patients. We want to credential ourselves. So the title of my track is called Sell It Like a Scholar, Leveraging Our Knowledge as a Strategic Sales Tool. During my presentation, I want to really explain the importance of credentialing yourself, of credentialing your knowledge, of explaining to your patients and educating them, giving them a very thorough, comprehensive consultation. And I have some tips and tricks and pearls that I'll also share with you all, because I believe in aesthetic medicine that we should all continue to learn and remain professional in this wonderful business that continues to grow. It grew over $1 billion last year, and it's going to continue to grow. And as we grow so rapidly, we want to remain professional. We want to remain legal. So AmSpa is just one of those organizations that will have my heart forever, because they helped me so much during the beginning of my own business. So I will be speaking on Friday, April 11th at 3:50. So please come by, say hello, say hi to me, talk to me, tell me a little bit about why you're there at AmSpa. I would love to make a connection, because I've made some of the best friends and colleagues and dear friends over the years through AmSpa and through the aesthetic medical profession. So I look forward to seeing you all at AmSpa in April at the beautiful Wynn in Las Vegas.
Hi everybody, my name is Jenna Hilton. I'm a PA. I work at Vibrant Skin Bar in Phoenix, Arizona. I have been a practicing PA for over 17 years. I started in internal medicine, family, and then added aesthetics about a decade ago. I would say my biggest success with aesthetics has been actually taking care of patients for that period of time, over 17 years, monitoring them and making sure that they're aging gracefully and that we're kind of growing together. I think that's a huge success, and being able to understand how their body's aging comparing to their family members and growing together. I think my biggest clinical failure is probably any time that I don't listen to my patients and what they're concerned about. So I had a situation one time where I had a patient come in. He had a concern of gynecomastia, so external appearance of that breast tissue. Of course, we always think about male breast cancer as something that we always want to think about, but then after that, just being able to support, something that else is going on with his system. So for his situation, I thought he was taking exogenous testosterone. I was like, your estrogen's elevated. There's no way you're taking it. He would deny it all day long. And I was like, it just doesn't make any sense. I would ask his wife. She thought it didn't make any sense either, and that maybe he was sneaking it. We didn't really understand. But we ended up referring him to urology because I just couldn't figure out why his estrogen level was so high. Well, it ended up being that he had testicular cancer, and I felt about this big when that happened. But the good thing is that we knew that things didn't happen, it wasn't making sense. And that at that point I needed to get someone else in the mix to kind of figure out why. So I think the biggest thing is thinking about, if a patient's telling you, they kind of know something else is going on. My panel is actually going to be on Saturday. It's going to be at 3:40, and it's the worst complication I've ever had and how to overcome that. And I think when it comes to complications, we always think about Hylenex and how to dissolve filler and how to, go into this emergency protocol, which is so important to know. But I also think that more often our complications that we're dealing with are with patients that are having problems with hypersensitivity reactions, overactive immune systems, autoimmunity issues. And so those are showing up externally as internal problems. And I think that's exactly how I love to practice, is supporting that external appearance from the internal health experience. So we're going to kind of talk about that. Yes, we have some crazy complications that we can talk about, but what are these other complications that we're seeing more and more and more often as we have these hyperactive immune systems that are reacting to injectable filler that tend to stay for a long period of time? So I would love to have you join me at the panel. I'm with fabulous providers on stage, and so we're going to be sharing that as a group, and I can't wait to see all of you guys. So it's going to be a fabulous meeting. Hope to see you there. Thank you.
Don't miss Medical Spa Show 2025, April 10th through the 13th at the beautiful Wynn in Vegas. Use code Medical Spa Insider MSS25, all caps, as a promo code when you register at www.medicalspashow.com. See you there.
Promo code expires on April 10, 2025 at 11:59 p.m. Pacific Standard Time. Promo code only applies to the primary registrant. Promo code cannot be applied towards additional attendee registration and cannot be combined with any additional offers. Discount only applicable to new MSS 25 registrants.